Good evening, everybody. I know it is 6:02, but imagine that you're in a healthcare clinic and it is 4:47 on Tuesday. Welcome to the podcast and the webinar tonight. We're going to be talking about Agentic technologies, but we're going to get our hands dirty today and work on Claude technology specific. We're going to get into a lot of things, but what I want you to do is put on this frame of mind, whether you work in healthcare, you work in this type of clinic or not, dentist office, doesn't matter. This all is the same type of principles, but imagine it's 4:47 on a Tuesday. You are sitting there, day's almost over, but then you open up your email and you see 19 unread email messages. They've come in from the patient portal. They're sitting in the inbox. Two of them matter, urgently. A bunch of them are patient refills. Can I get this prescription done? There's a claim dispute inside of there. And you know that these are the type things that people are waiting on for you, but it's 4:47. Imagine that this is potentially not you. This is one of your front office people. This is Denise. Denise is not the CEO. She's not IT. She's an office manager, and she is the one responsible for how the practice operates day to day. And if she doesn't get these type of things done, if Denise is out, things fall apart. We all know a person in a position like Denise. So what I'm going to do is show you how we can give Denise about 90 minutes of her week back. And I know that doesn't sound like a huge amount at the moment, but if you're sitting in Denise's shoes, that 90 minutes in this small 1 hour session is going to mean a lot to that person. And this is only just a starting point. So that 90 minutes that we're going to figure out how we can get back for Denise is going to be compounded on, because what we'll do in another episode or down the road is going to be, here's how we can give Denise back another 90 minutes. So these are bite-sized chunks. These are things that anybody can do, and it just requires a very simple subscription. So if you caught my last webinar, we made a lot of argument about the automation for AI and specifically around healthcare. And that was a big piece of this. We were talking about Agentic, and that was the OpenClaw episode with ClaudeBot and all this type of automation. I got a lot of feedback from that. I'm actually very surprised at how many people watched that, gave some feedback, and also reached out to me going, I saw your OpenClaw, your Moltbot, your other, and the NemoClaw, which is the one that runs on NVIDIA. That was geeky. My geeky friends had reached out and go, we had not heard of that one. Great one. But this is going to be something that is doable for everybody. So the last episode requires hardware, requires a lot of other stuff. This just requires a Claude subscription. So I have a lot of screen recording that we're going to do here live, and I'm going to show you a number of things. So here's where we're going to start off with this, and here's a promise underneath all of what we're going to do today. I will show you one of four things that is a task that kills productivity because it has to be done over and over. So this is something you need to do inside your organization, is kind of document those things up. It takes a document from being findable in 15 minutes to findable in seconds. It brings in the organization. It makes a process faster. And when you take these repeatable processes and shave a few seconds off of it, it's like a NASCAR team shaving a few seconds off of a process when the car comes into pit row. So it is time for us to look at that. And I do want to dispel a big myth here. You don't have to be technical. You don't have to be technical. You just have to have enough tech skills to follow along and to know that you're not going to probably break anything with what we're doing here. We're going to not touch things that need to worry about the guardrails as much, but we're going to now go in and take a look. So you don't need to be a prompt engineer. You don't need to be a doctor. You just need to be able to describe what we're doing. So what we're going to do here is I'm going to show you real quick. This is Claude. This is a Claude application. So if you see here, it says Welcome EG, and it has got a list of some of the prompts that I've been working on over here, the recent. But a couple things I want you to notice. We have 3 different modalities. So what we have inside of here is, if you see here, we have Claude Chat. Chat is what you're used to probably using. It is the one that you probably use the most. It is most ChatGPT, Gemini, all of them. Chat is that browser type interface. I just happen to be doing it here in the app. They work very much the same. Cowork is part of the desktop app. That's what we're going to focus on a lot today is the desktop app. We're going to set this up. You don't necessarily just chat with the space. You chat with all of the documents. You chat with that repository. So you take all the tacit knowledge that the LLM has, Claude, all of the books it read, all of the information it has, and now you're applying it to your expertise and everything there. And we're gonna work on that. It's kind of like bringing in colleagues from the office who have a lot of knowledge, putting them on the side to give advice as you're working on a document. Claude Code, that's for developers. We're not touching that today. That's something my developers use every day long. It is something that's quite powerful. This is not a developer session. This is not a geek one. This is more of a entry-level one, and we're going to now go into what we're going to do here. I do want to take just a second. I'll let you start looking here at the Cowork framework and a few things here. But I do want to give a quick disclaimer before we do the demo. Everything that you see today is about made-up patients. You are not seeing any HIPAA-related information. The real way to protect, and if you are in healthcare, glad to talk with you about this. It is a question that comes up all the time. You really should not be putting PII or HIPAA data into Claude or any LLM. There is a HIPAA deployment, and I have a HIPAA deployment version. So I have two accounts with Claude. I have one that is on an enterprise account, and we have a BAA for. And that does cost more money. The account that I'm working with today, we're going to assume that we're not touching any patient data because that BAA is not an account of this. I'm going for the level that most people are on, and we're going to say Office Manager, Office Work. We're going to work on that type of functionality. But just know that there is a HIPAA version. What we suggest is that you put in a healthcare situation when you are touching patient information, you use that HIPAA version, you do the enterprise contract, and you get that BAA. That keeps everybody compliant. It encrypts those files when they're stored over there. But be careful, it can run up cost because everything you put in there is now protected and isolated and run in your own instance area. But today, this version here, if you see down here in the lower left, it says EG Max. And what that is indicating is that this is the Max version, which this version of mine, I paid about $200 for this. So it doesn't break the bank, and I actually get way more than $200 worth of value over it. So let's go ahead and get started. Okay, so we're going to dive into this, and I'm going to show you the one skill that beats prompt engineering. People think getting good at this means writing the perfect 400-word prompt. Wrong. It's to get the most out of this, it's more about getting everything that comes out of your mouth into the right format and voice. Models got good enough that you can just keep it simple. Here's the entire framework. 3 layers, ICC instructions. So what to do, what to want. The who we are, what is the situation, and the constraints. The rules, the tone, the format. That's it. So if you look at this prompt I have here, this is really what I would suggest, and feel free to take a screenshot of this, copy it, whatever you want to do. You're going to want to put your same information in here. So this is kind of where we start building Denise's workspace. So the prompt is going to be that we're a med office. So what we're going to do here is we're going to be, in here I'm going to say and click on projects. And in the project, I'm going to call it front office. And for this demo, we're going to say that Denise works at Lakeside Family Medicine in Florida, and she's a part of the front office. This is a project room is what we're going to build for Denise. So the project room remembers everything Denise does. It shares the same contacts, the same files, the same instructions forever. she stops having to explain herself every morning into the chat because it knows everything. So now we have created the folder here, and so this is the front office Lakeside Medicine, and you see it's empty on the right. So now we're going to start by, let's say we're going to complain. So this is a nice piece to it, and you can actually chat via text in here. So let's see if this is going to work, because we're also recording this. We'll see how this goes. So here's our what we're going to put in. Honestly, I'm drowning. I'm the office manager at a small family practice. My week is denied insurance claims, prior authorizations that sit forever, a patient portal inbox that never gets emptied, and scheduling. Don't build anything yet. Interview me. Ask me questions you need so that I can actually help with all of this. One batch of questions. The reason for that is I want it to now come and give me the questions that it's going to now ask, and what it's going to think are the relevant items. So as you see here, it's working on it. It's thinking. Does take it a couple of seconds here. The great thing about being live. Okay, here it comes down. So here are the questions it wants to know. What EHR system are you on? Athena. Couple of them here, Advanced MD. Athena and Advanced MD are the two I'm most familiar with, of course, Epic. Which clearinghouse handles your claim? So it's got a little smart here because it's assuming the type of clearinghouses that we would see for this type of company. What patient portal are you using as part of your EHR or separate? Do you have O365 Google Workspace? That's a very important thing. It did win a little bit technical here with Power Automate and Zapier. But if you look, these are some great questions and start to the framework here. So I'm happy with this is where this is going. So now we're on the process of building it out. While this churns, the thing we're also going to do is think about the knowledge. So you see here, I have got some files that already are ready to go and go into the document repository. These are some of our SOPs. These are things that are important to the organization. They also have the silly stuff that we need to make sure gets in here that it knows, which are going to be the right contact information, the phone number, the address, the how we go with the name, who some of the providers are. So we're going to take these 4 files and we're going to upload them. So there are no patient names, there's no DOBs, there are no member IDs. These are documents that I know are going to sit inside of here and help me out, but they are not going to have any PII in them because we're operating in an unregulated area of a regulated space. So let's watch what this unlocks. So because I have now put in my payer information, it looks like it came back here with some great questions, but now I'm going to ask it this question. So this is the type of thing that these documents unlock. Which of our payers require a step therapy attempt before they cover this, and what's the exact policy line I'd quote, point out for me in the file. So we're going to put this in. This is going to prove that it's going to our SOP documents. This is how I know that it's now talking to the SOP. Let's see. Okay, this looks good. This is one of those things that you might have to go back and think about. If you've got a lot of payers, this found in 3 seconds. It was able to give me that information. So I gave enough time for it to learn those documents. They're now sitting in the project, but this is a question I might have to go, even opening up an Excel sheet, I don't think I could find that line in 3 seconds. So this is something that is probably a repetitive task. Think about other repetitive tasks. You're having to look up and go on a document. Okay, so now let's take some custom instructions. We don't want the AI to forget certain things. So when you use chat, you probably find if you've done a long chat, and some of these chat sessions I have here on mine have gone on for days, and I've experienced it as well, you get where it's starting to get a little dumb. It got out there It used up 80-90% of the main context it wants you to compress. It's now forgetting certain things. So we're going to give it this instruction here. And what we're going to do is tell it to embed what our answers and this document information. So I want to tell it to take everything you just learned from my answers and the files and draft a tight set of project instructions for you to follow in every chat in this room. My role, our payers, our appeal style, our patient tone, and a rule that that you always flag anything you're unsure about. Then ask me anything still missing. That's a very important. I want to highlight this here. Ask me anything that's still missing. This is how I prevent it from hallucinating so much. This is kind of my stopgap here of the instructions. So think about it as if you were training an employee. So if I were sitting at the front desk and training an employee, I would give them a set of instructions and say, if you see anything that doesn't fit this SOP, you come see me. This is that same type of instruction. I don't want them making, I don't want the human fantasizing and coming up. I don't want the AI fantasizing and coming up with hallucinations. These are clear instructions. So now we've given it this. So let's say this. Instructions are a job description. Memory is part of what it actually remembers. And it's going to remember over the next couple of weeks, not just today. When we turn this on, the tool is going to get better and better the more you use it. So just like an employee, as an employee learns and doesn't have to ask the same questions over and over, the memory function is going to allow us to do that. Now, if you happen to load a massive amount of documents, here we're assuming you're loading 4 to 25 documents into the system for a repo. If you're going beyond that, that's kind of outside of the scope. But it's going to work well on this. So here's a prompt. I'm just going to cut and paste this into it. Here's a denial claim for these codes, which I'm sure a lot of you know exactly what these codes are. Denied for not medically necessary, attached below. It's a third denial. Write a letter in our style that cites payer policy language. So this is a case where it would be good, and I'm going to come over here because we're now going to give it this information. So now it's going to write a synthetic document here for us, and it's going to write our language. So, and let's see, here we go. This is looking pretty good. Okay, this is a markdown file. So now I'm going to add to it. Let's type this, export as a word.docx. I like to tell it specifically docx because then it knows exactly what I want it to do. Okay. All right. Now, this is looking better. So let's go ahead and just download it as a Word doc. And yep, it's a good Word doc. This is good. Okay. So that's kind of our first skill. We now are able to have it help us write a document in the voice of the clinic. It's got the information on, and it's creating a real Word document. So this is now very usable work product and is highly repeatable. So your workspace is now smarter the next time you need to do it. So it's going to remember the next time what you did the previous time. So let's go into now what I'm going to call Demo B, Skill 2. It's a process that never quits. So what we're going to do in this section, in this second demo here, we're going to spend a couple minutes, and what we're going to do will help the LLM, but also help the employees. So this is a thing that a lot of companies, we come in and ask, what's your SOP on this? And sometimes they're a little soft and flimsy. They are written like 10 years ago, and they sure don't take into account AI. So here what we're going to do, we're going to spend a couple minutes here and get the appeal exactly right. So we want to make sure that we are doing things that are right up front. So if we can save 8 minutes here by doing it right, it's going to save us probably 28 minutes down the road of not having to. So what we're going to do here is drop this in. So package the appeal process. We're going to create a new SOP. So we're going to package the appeal process into a reusable skill. So inside of Claude, you can take functions and bundle them as a skill. Let's say that in the office, being able to generate labels for a particular test vial or something, that is a human skill. It is something that not everybody knows how to do. Same thing here. A skill is something we want to be repeatable, packaged, shareable with other people, as well as documented up for ourselves. So we're going to package this appeal process into a reusable skill. We're going to capture how we structure it, the confidence flagging, the policy citation, our tone, all of this. So what we're going to do here is we're going to create a new skill. We're going to call it the Lakeside Claims Appeal. So think about this, what happens in a small practice. The way that Denise writes the perfect appeal is now institutional knowledge. So that when she's on vacation, when she retires, when she decides to walk around the block or gets overwhelmed, this skill can be used by her and other people. So what we're going to do here, we're going to come here and we're going to go ahead and create a skill. And what we want to do is tell Claude, build a skill that assembles prior authorization packets, pulls the coverage criteria for our payers, matches them to the clinical notes that I paste, and produces a checklist of what is missing. So the important piece to this is that now that this is being bundled up and we should be able to test it. So what I want to now test is we're going to do a totally new denial. So I'm going to put in the new denial, 2061 denied as bundled, and handle it. So this is using, as you see here, I'm using the new Lakeside Claims Appeal skill. So I'm specifically giving it, I don't have to give it a whole lot of context. I just have to tell it what we're doing. And now, as you see, Claude's invoking that skill and produces the same quality appeal without me having to put in a lot of extra text. So I just saved having to type what we had before, which was, about another 2-3 sentences. Again, shaved a few seconds off. So what you'll end up with is a couple of these saved skills in your environment. Start off with this. From a framing the cost type of standpoint, the way you do it, yes, you're going to burn some hours up front doing this, but the denial workflow used to be, from a CFO perspective, that was about $3,000 worth of cost for somebody. Now it's going to go down to dollars plus your Claude subscription. We're making work faster now that Denise has something she's never done before, her own software. So this is also, this gives that sense of ownership for Denise because it is working the way that she wants it. Not the way the grouchy IT guy decided that it needed to work. It is the way that Denise wants it to work for her situation. So we're going to continue that thought here in the third part of this demo. We're going to build more of Denise's software because this is a bespoke Denise way of doing it. So this is going to be the denial tracker dashboard. No code, no IT ticket. We're also not going to put this on a server. This is just going to be local. So, and this is not going to be using Claude Code. We're going to be doing everything here, just point click into it. So everything so far that we have done, especially in this and previous demo, produces text and documents. The tools, here what we're doing is we're now producing tools. So we're going to now take a CSV of 90 days worth of denial. So this is a tracking document that is going to be tracked. We can have the system write to this CSV and keep it up. Now also what we're going to do is give a nice display to it. So I want to take, and we're going to, this is kind of a long prompt, not too bad here, but I'm going to go ahead and type and put this in. So We put this in, build me an interactive denial tracking dashboard for this file, total denials, blah, blah, blah. What we should get here is a dashboard that is kind of like a KPI tile system. We can actually keep enhancing this. This is where you can, Denise can say, I want a chart, I want a graph, I want something that I output, and you can even say, convert to PDF. So here we go. It is giving us a little bit here. This is looking pretty good for a first attempt. This is looking good. So, this is built, as you see, I don't have the patient's name. I only have numbers in here. We're not doing anything here with HIPAA data, but we are tracking in this dashboard the KPI type metrics that management wants to see. So this is the type of thing that afterwards we can share, we can PDF, we can email. It depends on what type of account you're on or whether you can share it directly out of here. You could say create a share. If your IT team can give you a place to put this on a SharePoint, that's another type of way of doing this. So I think this is one of those things that also makes Denise look like she is on top of the data, on top of the process, and being able to be an effective leader to her team by the fact that able to show the skills, are able to put this data together and do a better job in less amount of time. So now let's go on to the next part of the demo we're going to do. And we're going to go away from Denise, and we're going to take Denise's boss. We're going to take Dr. Andy. And shout out to our client, Dr. Andy. He ends up being a guinea pig in a lot of our technology in real life and in our webinar series. So we're going to try to get Dr. Andy 5 minutes of his time back. So it's not only the front office that we can do these type of things for. It's going to be also trying to get 6 minutes of time back for the clinician. And so here's the type of thing that we're trying to do. He didn't go to medical school to type. He is a decent typer, but he is very good at speaking. So watch this. What we're going to do is we're going to now take Claude and watch how effortlessly it takes to do this, so we don't have to even retype anything. So I'm going to take this, and we're just going to take this as a screen capture, and I am going to drop this in. So let's say that this is something else out of my webinar, or I have an article, and I drop this in here into the chat, and look, it is able to convert this screen capture into text. So now let's say that we want to now take a whole presentation. It can take screen captures, it can take PDFs, summarize recent evidence on this presentation, cite your sources, everything here. So we're going to feed it in this document from an email. So now Dr. Andy is able to summarize it. Yep, he could do that easily with chat. But here's what we want to do with this next. We want to take where we noticed that there are common citations, where we're able to save a couple times on this. There is some really good information, and what we want to do is have it focus in, because if we drop this document into our repo, if you notice in the sample document, the experts disagree. The LLM is going to miss that element. So in this document, if we were to drop this into Denise's workspace and say use this as a guide, the LLM is actually going to get poisoned where experts disagree, because we have pros and cons. We want to take only the elements out of here, and Dr. Andy could have taken a shortcut here that could have caused real problems with his staff, because if he injects this document from a reliable source into the repo and is telling it, I want you to use this as a guide, this whole section right here of disagreement, that is a problem. This is a big problem, because now your reference material is not going to be viewed properly. So even here in the summary, it is disagreeing with itself some. And what we want to now make sure we do is to eliminate that. So this is where human categorization is very important, especially as leadership. I know that you're watching lots of podcasts, you're getting lots of information, but if you're just taking transcripts and you're taking the pros and the cons and feeding them in, and it's not clear to the LLM, you're just feeding that document, then you're going to get the negatives as a positive. It's going to take everything and treat it, because these documents are not kept as whole. They're vectorized. The components of them get sliced and diced. So think of it like it's been run through a shredder horizontally, and those pieces now need to be reassembled. That's what the LLM does, and that's how it looks at the structured words. So what we don't want to do is put the bad knowledge in to our environment. So that's something very important. So this is where we put up those guardrails, and unfortunately they're human guardrails at the moment. But as a clinician, when you're feeding the information to the staff, we need to make sure that we take the positive elements and put our own documentation around it, and then say these are the things that we need to make sure. It needs to be so clear to do that. So we're going to take and do now the next piece of the demo. We're going to pretend that this clinic has a night shift. So this is a clinic that runs, second shift, third shift. So let's go into the night shift elements here, because now Denise needs to hand everything off. Okay, so far, everything Denise has done, she has been doing with the chat window. So not a big difference. Now we're going to bring in some added automation. So this is where we go into the Cowork side a little bit deeper. This is where we stop chatting and start handing off. So same brain, the same logic, just a little bit different relationship. We're going to give the keys and the to-do list to Claude, and we're going to come back and look at the results. So the great news on this, the first step we're going to do is we're going to complain again. So we're going to take a new window here, and we're going to type into it. Every morning I waste the first hour digging through the overnight patient portal messages, figuring out what is urgent. I hate it. You don't have to put that in. I just kind of like it. Ask me what you need, then set this up so it's done before I get in. So we're going to assume her computer is on and running overnight, and we're going to let the computer work the night shift, not a human working the night shift. So we're going to now go and just do a couple of quick changes here. And because it's going to be working with real files and real things, this is where a file called a Claude MD right in the folder. And we've talked a little bit about how to make this, but this is kind of the practices playbook for what it needs to do, switching tools, locking in the vendor. So if you look here at the Claude MD that I have, it's got some good clear instructions in here for the clinic and what we want to do. So now what we're going to do is, now also remember from a compliancy standpoint, we have to, this is going to be best if you're running the HIPAA ready version and the enterprise version of Claude, because you don't know what a patient is going to do, but we're going to do our best here and assume that it comes in. So what we want to do is have it deliver a report of what we're doing, of what has come in. So we're going to give it access, and I know this scares a lot of IT people, but it is what is happening. I'd rather be the ones directing the information. So what we're going to do here is try to give it as limited access as we can. We're going to have it configured to read off of this connector that is able to look at the inbox. So as you see here, I am able to type and say the first step here, and there's a little bit of setup config that we're showing here, but that's just part of the setup you have to do once. You don't have to do this every single time. So for this, I'm going to use my email box. So this is one that we use. It's an automated box. It where people email into it, it auto responds back to them. Show me the emails in the email check, WTE inbox. This is where your folder would be. Boom. And as you see, we're getting back the emails. So this is a relationship between this computer and O365. So I have approved it to go into that mailbox and to pull the messages out of that shared mailbox. So now we can look at what is in here. Again, Denise doesn't have to become a programmer. She just has to be the manager and delegate to Cowork what it needs to do. And it's now pulling back the information from O365 and is giving us a nice quick summary here. So this proves that I now have the access that I can run these commands and ask it to give me that type of roll-up in the morning when I come in. So this is where, the next thing is really, it's going to be the next thing you have to do is the adoption. So getting one person in the office to do it is great. Getting most of the office is wonderful. I would start with a couple. You don't have to take it from me. I mean, one of the largest pharma companies on earth runs this exact same playbook. It's just bigger. I've actually been lucky to be contacted by multiple big billion-dollar pharma companies about working with them and how these workflows can happen. But if you learn how to map out these processes, start with simple, prove what wins, pick one little thing, just find that couple 90-second wins for Denise, like being able to go in here into the inbox and see. You're going to get those great lifts. So the other thing is, now that we have it tied, we can actually see and fire off a skill. So I put an email in here specifically so we can fire. It's going to take a little bit longer here. It has to now go pull that email and pull it in. But this is now that time savings. So this makes you a champion in your office. It allows Denise to get that time back as the clinician. It gives them the ability to better push out repeatable processes to their staff. And if everybody can work on this and have the same playbook, it actually empowers everybody to become those more valuable employees that have the skill. I mean, right now, everybody is wanting to get skills in how to use these type of tools. And as an employer, you want your employees. That's one thing we do here. Lunch and Learns a lot. We are always training our people on how to better use a lot of the AI tools to make them more efficient. We put in place a lot of AI automation. The risk of using AI tools, I don't discount that. Not at all. There are some inherent risk in using it. The risk of not using them actually is not the safe route today. It's the invisible costs you incur. It's a tech debt that you incur by not taking and putting those skills into place. So here's how, hopefully we can help reclaim that hour of Denise's time. I hope that you all found this very informative. Start thinking about questions. I'm about to open up for questions. Over the next 48 hours, here's something I want you to think about. By Thursday, open Claude, don't write a clever prompt, just complain to it. So go into complain mode. This is a great time. It's not going to think any worse of you if you're airing some big gripes about how things suck. It may actually give you that pat on the back, but go into that mode and do a process. And what I want you to do by the end of Thursday is work for an hour or two and see if you can create a skill, a repeatable process. Just one document creation, one thing that you do repeated, one thing you have to do every week, package it up as a skill. If you're able to do that by the end of Thursday afternoon, or whenever you're watching this, the next 48 hours, I think that you should be able to find something build a skill in under an hour that will probably save you hours every month and be able to get you some of that time back. So that's kind of my final parting words. Now let's open up to questions. Isaac, it's time to look at the board. We got anybody firing some good ones at us today?